So hello, everyone. My name is Ines Hernando, and I am Eurodis ERN and Healthcare Director. And I'm here today with Silvia Aguilera and Simona Luis. Silvia is a patient representative in one of the European reference networks called Reconnect. And Simone is a patient representative in Gut Heart. That's the European reference network that deals with rare heart conditions. And we also have with us Sylvia's cat, has decided to contribute to this recording. So we are going to record very short 15-minute presentation on what are the European reference networks and what is the work that these two ladies and 300 patient representatives do in the European reference networks. So without any further ado, I'm going to share my screen. So what are we going to present to you in this 15 minutes is basically a very simple definition of what are the European reference networks, what are their objectives, what is the role of the ERN coordinators, so the clinicians who are leading these clinical networks, what is the role of the European patient advocacy groups in the networks, what is the role of the European Union member states and the European Commission. They are all actors in this new healthcare infrastructure. We're also going to cover a little bit how patients and patient organizations are involved in the European reference networks. And Simone and Silvia will explain to you what is the role of the European patient advocacy group advocates. So the patient representatives working in the ERNs. And then they will also briefly explain to you how Eurodis is supporting these advocates and where to find more information and resources. So I hope this will be useful for you and it will be simple to understand, which is the main objective of this recording and presentation.
Thank you, Ines. So just to start, as Ines said, we're going to talk about what are the European reference networks. So basically, they are healthcare networks that connect clinicians, researchers, and patient representatives working on the same group of rare diseases, complex conditions, or highly specialized surgery. There are 24 in total, and we are almost 1,500 expert centers located in the 27 EU member states and Norway. Each network focuses on a different group of diseases, like, for example, the network I belong to, which is Reconnect, like Ines said, includes rare and complex connective tissue and musculoskeletal diseases like lupus or antiphospholipid syndrome, which is my disease. And there are like Simone's ERN. Simone, how many are, we are 10 diseases in Reconnect. In yours, how many diseases do you have?
Oh, many more, but I won't go through all the diseases, but we have 5 thematic areas at the moment. And in the patient advocacy groups, there is growing participation of patients around Europe. So we had 2 more joining from Romania and from France and from Netherlands. And this year we had the congenital heart diseases added to the ERN. And I have a congenital heart disease myself, and I have a tetralogy of Fallot, which is one of the diseases, but there is many congenital heart diseases, and there is even a lot more heart diseases, rare heart diseases in total.
Each ERN is really particular with the diseases they have. They are structured very differently. As I said, Reconnect has only 10 diseases. There's other ERNs which have many diseases, and they group diseases by, as Simone said, by a disease area. So each ERN is really particular with how they are organized. So what are our objectives? So the main objective is, one of the main objectives is to facilitate the sharing of knowledge and clinical best practice inside and outside of the networks, to foster training of professionals and increase experts' mobility, and to accelerate research for rare diseases and contribute to build reliable epidemiological data on the burden of rare diseases. So all of this is with the aim of improving access to timely, accurate diagnosis and adequate care and treatments for the 30 million people living with a rare disease in Europe.
So Sylvia has told you a bit more about the ERNs themselves, and I will go into a bit more detail of the entities that are linked to the ERNs. So first we have the European Reference Network Coordinators. So there's 24, one for each ERN. And they are responsible for the strategic direction, clinical leadership, and the coordination of the activities. And they're also part of an overall group to align on matters that are common for all the 24 ERNs. The second linked area is the European patient advocacy groups, and we will go into a bit more detail in the presentation later. And they represent the voice and the interest of the patients in the network's strategic planning and activities. Then we have the member states and Norway, the EU member states and Norway, and they play a lead role in designation, the development of the networks, and also on their integration in the national health systems. And all countries have one representative in the ERN Board of Member States. And finally, but not least, we have the European Commission, which is the main source of the public funding, and they provide technical support and other services to all the 24 ERNs. And they also oversee and manage the designation of new providers that want to join the networks. So how are the patients and the patient organizations involved in these European reference networks? The European Patient Advocacy Groups, or the EPAGs, are basically patient groups which bring together rare disease patient advocates who are then actively involved in the 24 reference networks, working in partnership with the clinicians and the researchers. So as I said before, in our ERN, we are expanding at the moment. So we had like 10 people and we're expanding, and we hope to expand further, especially now that we have the new congenital heart diseases added. So we hope to expand, and especially we hope to expand to Eastern Europe, because it's always very difficult to find patient representatives there. And I don't know, Sylvia, how many EPAG advocates do you have in your group?
So for us, we are trying to reach 2 advocates per disease. So we would want to be 20, but we are currently 10, as we have some ultra rare diseases and we are just not finding the advocates. But 10 is very good. We have almost all the diseases covered, but it's true that we are still looking for EPAG advocates for some of the diseases.
Okay, thanks. So we have basically 2 levels of patient engagement in the European reference networks. First is the blue ball in the middle, which is the patient organizations which are registered in Europe and that have really defined an advocate to join the EPAG, like myself and Sylvia, and they are associated partners. So those patient organizations are called associated partners. Then we have supporting partners, which are in the gray areas, which are patient organizations which are registered in Europe, but have not defined an advocate to join the EPAG, patient organizations which are registered outside of Europe, and individual patients and family members and social media-based support groups. Those 3 groups may be invited to collaborate with the ERN and the EPAG on specific tasks, projects, and can also help to disseminate information about the ERN. This is the governance structure that has been defined. It's not fully implemented by all the ERNs, but this is how we ideally want to look at it.
Going on to talk about what's the role of patient advocates is and the patient advocacy groups, we want to ensure that the needs of people living with rare diseases drive the activities of the ERNs. We champion the diversity of views of the wider patient community relevant for each ERN and not just our own disease area. Actually, sometimes we do participate in meetings where we have to represent all the diseases of our ERN. So we are also required a bit to learn about other diseases in our ERN or other disease areas. We work with our national and European networks to facilitate two-way communication between European reference networks and the patient community. This is very important because we are really the representatives of our whole community. And we work in partnership with the clinicians to support development of standards of care, clinical decision support tools, and contribute to research, education, information, and awareness activities. And I have to say this is key in the ERNs, as the collaboration with clinicians is something we strive for and is the base of the good working of the ERNs. So how is Eurordis supporting us to being involved in ERNs? So Eurordis supports us by involving the EPAGs in developing tools and processes to fulfill our mission in the ERNs. They facilitate the engagement of advocates in different areas of work, like clinical practice guidelines, which Simon will talk about later, that we have a working group, clinical decision support tools, research, evaluation, training, and communication, which we also have some working groups on. They also facilitate peer learning and exchange of group practices between EPAG advocates on a regular basis. And we do have regular meetings of EPAG advocates saying what has worked or has worked a bit less, so that other ERNs learn about this and maybe they can implement that in their ERNs. And they support the overall governance of EPAGs and recruitment of new advocates and help identify the new candidates.
As Sylvia just said, Eurordis manages some working groups that favor peer learning and supports advocates in the following areas. So if we look at the clinical practice guidelines, they really support the advocates to engage in the development of the guidelines and also other clinical decision support tools. If we look at the training and education, they help to evaluate the training needs from the EPAG advocates, and they also propose training activities to the ERN coordinators. The consolidation of ERNs is really about the steering committee, where the EPAGs of the different ERNs exchange information on strategic activities in the ERN and also exchange ways to be able to engage in a better way and learn from each other. The research and registries group is, well, sort of self-explanatory. It's really about supporting EPAGs in activities linked to registries and research activities. Connecting the patient with the ERNs is really about the EPAGs working with national alliances on communication materials, such as this presentation and this recording. And also we created, now I'm part of that, and also we created an EPAG fact sheet, which is a one-pager explaining what the EPAGs are and what they do. So it's a bit shorter than this presentation. And we are still continuing to work on creating more documentation and supporting materials going forward. And then we have the quality improvements, which is really about supporting the EPAGs advocates to be engaged in the monitoring, evaluation, and quality improvement of the ERNs going forward.
Okay, thank you for that, ladies. That was very good and very clear. Hopefully everyone by now, when they listen to the word ERN and EPAG, they can know what we are referring to. ERNs are the European Reference Networks, EPAGs are the European Patient Advocacy Groups, and EPAG advocates are these two ladies, the patient representatives working in the European Patient Advocacy Groups. We have included in the slides some further information and resources that you might be interested to look at, especially if you would like at some point to be involved as a patient representative in the ERNs. I would really encourage you to have a look at the EPAG fact sheet to find out how they are, the representatives are involved. And you also have, there are some contacts, detailed contacts that you can use if you are interested to find out more. You can contact directly the representatives. Our website has also some information about the skills, the responsibilities that you would be kind of required to bring into the group. And you also have a lot of information in, of course, in the website of the European Commission. And then for those that are really, really interested, you can have a look at the legislation that underpins all this new clinical infrastructure for rare diseases. So we hope this recording will be useful for you, and we're really looking forward to continue doing more of this bite-sized recordings and pieces of information that can help digest and demystify a little bit what the networks are and what is their work and their contribution to improving the life of rare disease patients. Thank you very much, and goodbye.